Hey everyone, welcome back. This deep dive is all about a topic that you requested, and that's adult autism, specifically the differences between PDA and ODD.
Yeah, it can be pretty confusing, and so many people get them mixed up.
Right, and you sent in a bunch of sources and articles to help us sort it all out. And this article from Cheap ABA called Adult Autism. Understanding the difference between PDA and ODD is a great starting point.
For sure. It lays out the basics really well.
So what we're going to do today is really dig into PDA and ODD and what those terms actually mean, like how they show up in your life, not just like a dictionary definition, you know?
Totally, because it's not enough to just know the label. You've got to understand what's going on underneath.
Exactly. So let's start with the basics. The article really emphasizes how even though PDA and ODD might seem kind of similar on the surface, especially when you're talking about challenging behaviors, they really come from totally different places.
Right. It's like they're two sides of the same coin. Maybe they look similar, but they're made of totally different stuff.
I like that analogy. So how would you explain the core difference between PDA and ODD? Like, where are those behaviors actually coming from?
Well, with PDA, you're dealing with this intense anxiety and a need to stay in control, which ends up making the person avoid demands, even demands that they might actually want to do. It's kind of like, imagine having to perform on stage, but you have terrible stage fright. That's the kind of anxiety someone with PDA might feel just facing everyday stuff.
Wow. So it's not about being defiant just to be difficult. It's a much deeper thing. The article uses the word motivation to talk about this difference. What are some of the ways people get PDA motivations wrong?
Oh, man. One of the biggest ones is thinking that people with PDA are just trying to manipulate you or get attention, which is so far from the truth. When you realize that their actions are coming from this deep-seated anxiety, and that's usually triggered by feeling out of control, it totally changes how you see things. It's not about being bad, it's about feeling overwhelmed.
Yeah, like that totally makes sense. And it makes me think of this time I saw someone having a meltdown when they were asked to do this really simple task. And at first I was like, what's the big deal? But now understanding PDA, it makes me realize that it was probably an anxiety response, not defiance.
Exactly. And that's where the difference with ODD becomes really clear. Someone with ODD might also refuse to do something, but they're doing it because they're angry and they want to have power, especially over authority figures. Like, they might actually say, you can't make me.
So the reason behind the behavior is totally different, even if it looks the same from the outside. And the article also mentions another interesting point about flexibility. Do you want to talk about that for a second?
Oh, yeah, definitely. So the article says that someone with ODD tends to be way more rigid, while someone with PDA can actually be pretty flexible, but only if they feel like they're the ones calling the shots.
Interesting. So it's like they need to feel like they have agency in the situation.
Exactly. Like someone with PDA might be totally happy to go to a party, but only if they get to decide when they arrive and leave. On the other hand, someone with ODD might refuse to go at all, even if it's something they usually enjoy, just because they don't want to be told what to do.
That's such a good example. It really highlights how understanding these little differences can change how you approach interactions with someone who might have PDA or ODD. So we've been talking a lot about behavior, but I'm curious, how do these conditions affect relationships? Because it seems like both PDA and ODD could make things pretty complicated.
Oh, for sure. And again, it all comes back to that root cause. If we think about the anxiety and control issues we've been talking about, it makes sense that someone with PDA might have trouble starting social interactions, because all that unpredictability and potential for demands can be really overwhelming.
They might avoid social situations altogether.
Yeah, often they do. And on the flip side, someone with ODD might actually look for conflict as a way to assert control, which obviously can lead to a lot of tension.
Right? So we're seeing these really different patterns of behavior play out in relationships, depending on whether it's PDA or ODD. And that's super interesting.
It really is, like two completely different ways of navigating the world, even though on the surface they might look pretty similar.
Exactly. So we've talked about why people with PDA and ODD act the way they do. But what about now? Like, what can we actually do to support them? What does the article say about creating a supportive environment?
Well, it all boils down to figuring out what's causing the behavior in the first place. Like for someone with PDA, the biggest thing is to reduce their anxiety. So that means creating an environment that's calm, predictable, and where they don't feel pressured.
So no surprises and sudden changes.
Right, exactly. And giving them choices whenever possible is huge because it helps them feel more in control, which helps reduce their anxiety.
That makes a lot of sense. So you're saying that for someone with PDA, feeling in control is like this key ingredient to helping them manage their anxiety.
Yeah, definitely. And it's not about letting them run the show or anything. It's about giving them a sense of agency within a structured and supportive environment.
Okay, so we've got the PDA side of things.
Yeah.
Now, what about ODD? What does a supportive environment look like for someone who's struggling with that?
Well, for ODD, it's a little different because remember, their behavior is often driven by anger and a need for power. So clear boundaries and consistent consequences are super important. It's not about punishment. It's about helping them understand that their actions have predictable outcomes.
Got it. So it's like teaching them cause and effect in a way that feels fair.
Yeah, and positive reinforcement is really important too, because even though they might not always show it, individuals with ODD often crave attention and approval.
That makes sense.
Yeah.
It's just that their way of getting it can be a little, well, challenging sometimes.
Exactly. And that's where positive reinforcement comes in. By focusing on what they're doing well, even the little things, you can encourage those positive behaviors and help them build a more positive self-image.
So it's like a shift in focus. Instead of constantly pointing out what they're doing wrong, you're highlighting what they're doing right.
Exactly. And I think that's a good place to pause for now.
Yeah, for
Yeah.
sure. We've covered a lot of ground already, but we've only just scratched the surface. There's so much more to unpack when it comes to PDA and ODD. So make sure you stick around for part 2 of this deep dive, where we'll explore some of the specific strategies and therapies that can help individuals with these conditions thrive.
Can't wait to dive back in with you. See you in part 2.
Okay, so we were talking about how important it is to create that supportive environment for people with PDA and ODD.
Right. We talked about what that looks like for PDA. So let's dive a little deeper into what support can look like for someone with ODD.
Okay, so for ODD, clear boundaries and consistent consequences are really important.
Which makes sense because we talked about how their behavior is often driven by anger and a need for power.
Exactly. It's not about punishing them or anything. It's about helping them see that their actions have real consequences,
Yeah.
and those consequences are always the same. Right, so it's about creating a sense of predictability.
Exactly. And positive reinforcement is huge here too. Like I mentioned earlier, even though they might not always show it, individuals with ODD often really want that attention and approval.
Oh, I bet. Because, like you were saying before, their way of trying to get that attention can sometimes be a little bit, well, let's just say unconventional.
Exactly. And that's where positive reinforcement can make a big difference. By focusing on the good stuff, even the little things, you can really encourage those positive behaviors and help them feel good about themselves.
So it's like changing the whole dynamic. Instead of always pointing out what they're doing wrong, you're highlighting what they're doing right.
Exactly. And I think that leads perfectly into our next topic, which is professional support. The article talks about therapies like CBT and ABA.
Right. Those are often mentioned as helpful tools for managing PDA and ODD.
Yeah.
But to be honest, I'm not totally clear on what they are or how they work. Could you break those down for us?
Sure. So CBT stands for Cognitive Behavioral Therapy. And basically, it helps people change the way they think about things. So for someone with PDA, CBT can help them recognize and manage those anxiety triggers and come up with ways to cope. And for someone with ODD, it can help them learn to control their anger and find healthier ways to express their emotions.
Okay, so it's not just about changing the behavior. It's about changing the thought patterns that are causing those behaviors.
Exactly.
Yeah.
You got it. And then there's ABA, which stands for Applied Behavior Analysis. ABA is all about understanding how behavior works and using that knowledge to create positive change. So you look at what happens before the behavior itself, and what happens afterward. And by making adjustments to those things, you can increase the good behaviors and decrease the challenging ones.
So for someone with PDA, ABA can help them learn to manage those overwhelming feelings of anxiety so they don't have to avoid demands as much.
Exactly. And for someone with ODD, ABA could help them learn how to communicate their wants and needs in a more appropriate way, which can reduce those power struggles.
It sounds like both CBT and ABA offer really useful tools for understanding and managing PDA and ODD. But is there one that's generally more effective, or does it depend on the person?
It really depends on the individual and what they're struggling with. What's important is that the therapy is tailored to their specific needs and strengths. And sometimes a combination of therapies, along with other support strategies, can be the most effective.
Makes sense. So it's not a one-size-fits-all situation.
Right. You really have to take a personalized approach.
Okay. So we've covered a lot of the differences between PDA and ODD and some ways to support people who have these conditions. But now I want to bring it back to you, our listener. You've been so awesome about researching this topic. So how can you use this knowledge to actually make a difference in your life or the lives of people you care about?
I think the most important thing is understanding. Recognizing what's really driving a behavior, whether it's your own behavior or someone else's, can totally change how you respond to it. It's like having a map instead of just wandering around in the dark. It gives you direction.
Right? So instead of just reacting to the behavior, you can start addressing the root cause. which is a much more compassionate and effective way to approach things.
Exactly. And remember, we're not trying to fix anyone. It's about providing support and tools to help people thrive.
That's such a crucial point. It's about empowerment, not judgment.
Absolutely. And having an accurate diagnosis is a really important first step. The more we understand about these conditions, the better we'll be able to provide the right kind of support.
And that brings us to another important point, which is that PDA and ODD are often misdiagnosed or misunderstood. So having the right information can make a huge difference in getting the right support.
Absolutely. It's about advocating for yourself or for someone you care about and making sure they get the help they need.
So this deep dive wasn't just about learning some facts. It was about giving you the knowledge to make informed decisions and to really advocate for positive change.
Exactly. And remember, this is just the beginning. There's so much more to learn and explore, and so many resources available to help you on your journey.
So keep asking questions, keep learning, and most importantly, keep connecting with others who are going through similar experiences. Your willingness to learn and grow is amazing. And remember, even though we've reached the end of this particular deep dive, your journey of understanding and support is just getting started. This has been amazing. I mean, you've clearly put so much thought into this, and I know this information is going to help you so much moving forward. We've really covered a lot today. We defined PDA and ODD, looked at those big differences in what motivates them and how flexible they are. And we've even touched on relationships and what support can look like.
And how crucial getting the right diagnosis is. Because that understanding is what allows you to offer support that really works. And that comes from a place of compassion.
Totally. And remember that meltdown example I mentioned way back at the beginning?
Yeah.
The one that seemed like such an overreaction? Well, now that we've explored PDA, I bet you're seeing that situation so differently.
Right. 100%.
Yeah.
It just goes to show how powerful knowledge can be. It lets you approach those tough behaviors with way more understanding and empathy.
And that's what this is all about, right? Not just judging the behavior, but trying to understand where it's coming from.
Absolutely. And this knowledge can also help you advocate for yourself or someone you care about, to get the right diagnosis and the right support.
So it's not just about absorbing information. It's about having the tools to advocate for real change.
Exactly. And to feel empowered to ask the right questions and seek out the resources that will help.
And speaking of resources, there's so much out there. Books, articles, support groups, online communities.
So much good stuff. It's all about finding what works best for you.
Keep learning, keep asking those questions, and keep connecting with people who get it.
Yeah.
Who are navigating the same challenges. Your willingness to learn and grow is so inspiring. It's awesome.
I think that's a perfect note to end on.
I agree. It's been such a pleasure having this conversation with you. And remember,
Yeah.
even though we're wrapping up this deep dive, your journey of understanding and support is just beginning. You've got this